back. Many seniors rely on several different medications to make it through the day. Dr. Laurie Archbald-Pannone, a UVA geriatric specialist, joins us for today's house call. Thank you for being here.
Thank you for having me.
First of all, can you tell us a little bit about polypharmacy, what it is?
So polypharmacy is when you're taking multiple medications, 3, 4 more medications, which is not that uncommon. You know, if you think about it, if you have had a heart attack or heart disease, you can be on 4 medicines just for that alone, and so medicines can quickly add up.
Yeah, and there are some concerns for people who are taking multiple medications like that. It can be a lot of people. What are some of those things you kind of start to worry about?
Yeah, so there's nothing wrong with a lot of medicines in and of themselves. We just need to make sure that all the medicines that we're on are what we need to be on. So the concerns come in, the medicines can interact with each other, or they can interact with our body differently as our body changes, as we age, or as perhaps we get more medical conditions or lose weight or gain weight. How medicines interact with our body can change, and so that's the concern that we really need to be ready to address.
Yeah, and the people that are watching right now saying, hey, that's me, I do take a number of medications, what would you suggest for those people?
Well, I would suggest to talk to your doctor about the medicines that you're on, and not just the medicines that are prescribed, but also anything you get from the drugstore, over the counter, herbal medications, to really every once in a while, every 6 months, year, just bring them in and talk with your doctor about the medicines that you're on to make sure that they're still the right medicines for you, they're still the right dose for you, that they're not interacting with each other or with other medical conditions, and to review them periodically to make sure that they're still the right medicines for you.
Yeah, and if people have concerns, where would you say for them to go? Just go to their doctor, probably straight to the source.
Well, I think it's always good to talk to your doctor about it, and it's always important to talk to your doctor when you can have these step-back times, not when something big or acute's going on, but to say things are going well, but let's step back a little bit and make sure everything's where it needs to be. Patients, especially patients that are older or elderly over 65, can also talk with a geriatrician about that as well.
Perfect. Some great tips. Thank you so much for being here.
Thank you.
Back to you.